Cholesterol itself isn't bad, it's essential for hormones and cell walls, but when the wrong particles build up in arteries, risk for heart attack and stroke rises fast. Cholesterol travels in the blood on lipoproteins. LDL carries cholesterol to tissues and can deposit plaque, while HDL helps carry cholesterol back to the liver for removal. Triglycerides are blood fats used for energy. High levels with high LDL or low HDL amplify artery plaque formation. LDL is the primary driver of atherosclerosis. Lowering LDL consistently reduces heart attack and stroke risk. HDL can be protective, but raising HDL artificially hasn't reliably lowered events. Focus stays on cutting LDL and managing triglycerides. A useful rule of thumb: the higher the risk, the lower the LDL goal. Very high risk often aims for less than 55 mg DL with at least a 50% drop. A fasting or non-fasting lipid panel reports total cholesterol, LDL-C, HDL-C, and triglycerides. Non-fasting is fine for most, but very high triglycerides may require fasting. Retest every 4 to 12 weeks after starting therapy, then every 3 to 12 months to track progress and adjust treatment. Shift fats. Replace saturated fats, fatty meats, butter. Many baked goods with unsaturated fats from olive oil, nuts, seeds, avocados, and fatty fish to lower LDL. Add soluble fiber. Oats, barley, beans, lentils, psyllium, apples, and citrus bind cholesterol in the gut. Higher fiber, plant-forward patterns can lower LDL 10 to 35% depending on intensity. Whole patterns, Mediterranean and DASH-style eating lower LDL and cardiovascular events over time. Weight loss of even 5 to 10% improves LDL and triglycerides, while regular activity helps raise HDL and lower triglycerides. Alcohol drives triglycerides up. Cutting back and avoiding added sugars lowers them meaningfully. Statins are the backbone, lowering LDL 30 to 50% plus in risk of heart attack and stroke. Add ezetimibe if LDL remains above threshold. In very high risk, if LDL stays as greater than or equal to 70 mg DL despite maximal statin plus ezetimibe, consider PCSK9 inhibitors to reach deep lowering, often less than 55 mg DL. No baseline numbers. Set a personalized LDL goal based on risk and focus on LDL lowering first. Build a weekly menu with olive oil, nuts, beans, oats, and fish. Swap butter and processed meats for plant proteins and seafood. Recheck labs after 4 to 12 weeks to confirm progress and adjust therapy to hit targets. If this clarified cholesterol, tap like to spread heart, smart info. Share this with someone working on their numbers and subscribe for practical, evidence-based health videos like